Watch your
Finance Committee is called to order the December 19th version of it before Christmas. Dr. Jones. Counselor Glaughton.
Here.
Counselor Allamon.
Here.
Counselor Smith. Here. And Counselor Harden.
Here.
All present, you got all five.
Sorry, buddy.
You have a quorum and everybody.
Okay, wonderful. Okay, do I have a motion to dispense with
Yes.
the reading of the minutes and approve them as distributed? Moved by Mrs. Smith, second by Counselor Allamon. Any other questions? All in favor say aye.
Aye.
Here.
All opposed by the same sign, 5-0, that passes. Okay, we have.
Did you get the text I sent you?
Yes, I did.
Okay.
So we're going to take it out of order, 04-12-22. Request for consideration of changes to city's workers' comp occupational and medical clinic. And did you have some comments on the clinic to start us off? Okay.
So,
Here's a sign-in sheet.
This was brought to both the mayor and myself about, in particular, wait times dealing with drug screenings. We've had a number of, or it's been reported to us that we've had a number of issues with getting people in and out, where we've had to even take people to other locations to get people back on the job and things like that. So anyway, that's the genesis of the item. Harold Parker, who oversees that program, can't be here tonight. But I know that we have people from St. Vincent's here to speak to it. I certainly would like to hear what they have to say, and then if we could carry the item over after that to give Harold a chance to come back and sort of give us a little bit more detail about what his concerns are.
Okay.
Hi, I'm Kim Starling, and I'm with Ascension St. Vincent's, and Mike Smith and Tommy Cannon are with me. So it was brought to our attention, and that Harold has some concerns about the drug screen. So we do want to kind of share with you some more of the statistics in the clinic and kind of give you a better idea of what's going on. So first of all, you know, Harold only manages the drug screen portion of the program. He has not privy to any of the information as far as the work comp entries, the follow-ups, the pre-employments, the physicals that we do. That is the largest portion of the business that we do for the city. So the drug screens are a very, very small part of it. One of the things that Mike's going to share with you is the actual wait times for the entire year. You're going to be able to see that our wait times are very, very low. We do have some situations with drug screens, and Mike will share with you. Sometimes the patient will present with a shy bladder. They have to wait 45 minutes to an hour and drink water before they can even produce a specimen. Sometimes they come in and we've got 4 or 5 entries in front of them, and so there might be a delay. But I think our average wait time for drug screens is less than 40 minutes. That's a pretty good. We do have isolated cases that Harold has reported to us, and we have addressed them. There's very few. When you look at the 200 or 300 drug screens that we did for the city over the year, we only pulled out 5 that we felt like that was inappropriate wait times. So a couple things too that we wanted to point out to you is that we do oversee 14 municipalities. So we handle most all municipalities in this market. It's a little bit, Homewood's a little bit different because you have 2 people actually doing drugs. So you have Safety First and Harold, both doing really the same thing. So it's a little bit different for us because of that setup like that. Safety First, I guess it's kind of like your TPA, your third party. Okay, so we don't have anybody else that has 2 people doing the same thing. So we do our best. The other thing too that I want to point out is that, you know, we do have 3 providers at our clinic. So you're always going to get a provider. I know Harold probably has proposed Alicomp just right down the street from us, and it's a one-man show. It's a one provider there. We are connected with St. Vincent's downtown. We have been doing some pre-planning with the fire department to actually come on site and do the fire physicals for next year so that the truck can stay in service. We've met with the police department, and they're considering they want to try to do some physicals for next year too. So we've got a lot of things working. I'm really, really proud of our program. I think we have an incredible program. Do we have some situations where Harold's been upset with the drug screens? Yes. And have tried to address them one-on-one, but Mike is going to share with you the actual numbers. So I want y'all to be sure and get the facts so that, and we're happy to share them with Harold too. I actually talked to Harold today, but I did not share anything with him, but.
Let me ask you a question, because I'm one of the ones that.
You send them.
That I send mine, and I can tell you, in the last several months, I've got people I've sent for drug tests that have been 2.5 hour, 3 hour waits to get a drug screen. I'm right now, I'm already down so many people, I can't wait that long. I had a guy that we had to take home because he gets off work and he missed his ride. I mean, don't get me wrong, I understand and I think, but to me, 45 minutes is a gracious time to wait to have a drug test. And I mean, I know your numbers. I'll say this, when we first started, it was great. And if I call Harold and he calls one of y'all, yeah, they usually get in. But then when the next week or two rolls around, I'm right back into the same boat I was. And this has happened multiple times for me in my department. And I've got 100 and something employees. And so for me, I can't have people there 2 and 3 hours waiting on a drug screen. That to me, I just can't do that.
Can we get what the numbers are?
We
What
can,
the actual
and we
numbers
can
are?
pull out the individual patients and we can share with you the reason.
And I will
we have
get,
to train a
because we've
person.
got those people, because Harold and I went through this thing. And I mean, like I said, up until probably the last 6 months, 9 months, but it seems like every time now we send somebody, they're there for a while. And I mean, to me, again, I know there's others coming and all that, but a drug test really, to me, drug screening for 45 minutes, and you should be in and out of there in 45 minutes.
And they usually can be if they're able to produce a specimen.
Yeah, and let me say this, and the ones that I'm referring to, I mean, they sat there and waited. And I mean, I know there's several that he's talked to you about that were my guys that went in, I mean, and gave the paperwork, sat down and waited. And so I don't want to tell you that your times are not right, because I know they are, but I can tell you, for me and my 2 departments, we've had issues the last 6 months. And I mean, it's not just an isolated one here and gone. It's been multiple for me, so.
Yeah. And like I said, and like Mike pointed out earlier, is, work comp is basically a freestanding emergency department.
Oh, it is.
For work related.
Yeah.
So we do see a lot of injuries, and they do take priority, just like the cities. I mean, work comp injuries and follow-ups take priority. Like I said, there is room for improvement in drug screens.
Yeah.
We get $10 a drug screen.
I understand.
So
And look, you make your money off workers' comp. But for me, I got both edges of the sword. I don't have time to wait on, because a workers' comp to you may be saying, well, that guy trying to get, that's costing me to have a truck down, is just as important to me as the workers' comp is to you. So I just need somewhere we got to get some compatibility here that.
There are other options for drug screening locations, and I'm happy to share that with Harold and go over it with him.
Okay.
Walgreens is starting to put in these little, like a little closet, and it's for employer work comp drug screens. I visited there myself about 2 weeks ago, and I was in and out in 15 minutes. That's all they do is drug screens. So there's plenty of options for the drug screen.
Yeah.
I just want you to really consider the other big portion of the city's business, because I feel like that we've done an incredible job, taking care of the entries and the follow-ups and the fiscals. You moved over with us from Brookwood. We were at Brookwood, all of us, and we moved over to St. Vincent's, and y'all followed us when Mayor McBrayer was here. So that's the part that I'm really, really concerned about, because we do have some options, and we can help you improve that process.
That's fine.
I'll let Mike share some numbers.
Just to, and I'm sorry, if I'd have known you had a projector, I'd have brought something for slides, but I didn't, and I didn't bring as many copies as you guys need, but you guys are welcome to go through them and share them later. There's just some graphs of some detail, and this is actual backup detail as it relates to it, and these are, like Kim said earlier, drug screens are a portion of it, and yes, as far as the revenue, but I don't want to get onto the dollar amount for a visit and so forth. I'm not really going into that too much detail, because that's not what our staff, the hourly wage staff that are doing these drug screen collections, aren't concerned about that. They're not sitting there going, well, this one makes more money, and has no factor in it. Okay. What you will see on the top of this graph that when you get to see it, you'll see 14 different categories. Of the 14 different categories that are in there, and they really, in these categories from left to right, are based on importance and the need for the attention from the medical assistants that are in our office and the attention that they're providing. From the work comp new injury, to the follow-up, to the physical, to the, so all the patient-related care pieces that are in those 14 different categories. In those different categories, you also have multiple components. A drug screen is a component, okay? So it is one single component that a CMA or a nurse or a medical assistant would be performing as a component. A work comp initial, for instance, may have 12 components all of its own, okay? A follow-up with an injury would have 10 to 12 components all of its own. So yes, it is a short process. It's actually, and I'm not going to tell you otherwise, it really takes 7 to 8 minutes to do drug screen. So you're not wrong. I know you know. And I do too. It's not a long process. It's not a difficult process. It's probably, among those 14 different categories, it's probably an easier category of it. However, the task itself, based on the severity within the pull order and treating these patients and getting them back, and not to mention the number of individuals. Now, we do try hard to make sure our first responders are identified in order to put them back out onto the streets as soon as possible. We do try to do that. And as much as I would wish I had there's always an individual in the office pointing out each and every one of them, making sure. We do have methods in which we do put a priority on that, and we try to move them through the process as quick as possible. Oh, thank you so much. I appreciate that. The second column that you see is, so those 14 categories are listed at the top there. Everything from the new injury, like I said, physical evaluations, follow-ups, annual physicals, fitness for duties, those are returning duties, audiometric tests, immunizations, TB testing, screening, which is a multitude, lab testing, breath alcohol testing, drug screen testing, and then TB reads on the very far right. So there are multiple categories, again, multiple components within each of those different categories. So and this is all Homewood. So every bit of this is just, this data is specifically for Homewood. So if you scroll down just a little bit, you'll see it actually, those top 5 categories are broken down into the providers themselves. So these are the medical providers in our offices, including the CMAs, which are on the far right. These are their treatment times, and those averages, those exam times, and those wait times. So in those 3 categories, and of course Shelton on the far left is going to be higher because she's PRN, so she doesn't see the volume that anybody else would, like a Thus or a Sue. So their numbers are skewed, so it's going to be longer wait times. So these are just as an example of the data that you're pulled. Now, of the 5 that we kind of identified just from the data that we pulled that was really glowing, those specifically events, one of them was he had 2 events. So he had 2 drug screens, 2 components within that. The first drug screen, he didn't provide enough of his specimen. That basically, now he's emptied his bladder, he started over, and now it goes on to the second event. You've got to start it again, because if it wasn't a quantity that was sufficient enough, then that process, now he's got to fill his bladder, and everybody's time frames take a little bit different. As much as I would like everybody's to fill up in 30 minutes, it just doesn't work, and it takes could take it 2 hours. And in this event, that's exactly what happened. His second event took 2 hours to finally to finish. And that's why that one was a 3-hour wait for that particular person. Another one was one event, and it was a 1-hour process. It was at that time, though, and just to give you a little bit of detail, there were 35 visits that came in before this individual had arrived at the clinic. 35 other individuals had all come into the clinic for multiple different needs. Another one. It was a 1 event. It was there for 2 hours. That one was 50 different visits that were all at before and at the time of his arrival, and 30 of them were physician related, which were those top categories at the top. multiple components, multiple things pulling away our medical assistants and so forth that were delaying drug screens from happening faster than they would in a 15, 20, 45-minute, time frame. So, moving on, we got another one that was a one event, 2 hours long. That one identified that was an appointment error. We found an appointment error in that one. His arrival time was one time, his appointment time was a different time. But based on his appointment time, not that we're finding good stuff in the bad moment, but he was seen in 30 minutes and based on the time he was put in for, which was incorrect. But again, should he have been put in correctly, it'd have been anticipated to be a 30-minute visit. So, and then the last one was 2.5 hours for that one. Again, there were 60 visits at that time. Again, there were around 35 physician-related injuries, multiple components, and so forth, taking away those those critical medical staff members that are pulling that away.
One of the things that Mike and I talked about earlier, when you see that WCI and you see that hitting that 2-hour mark, you want that number to be high. That means that is one-on-one, face-to-face time that provider is taking care of an injury. So you want that number to be high, because that means that provider is really spending some time with him and taking care of the injury. Because another thing that we have just implemented and had approved by Travelers, which is your TPA for work comp, because we're associated with St. Vincent's and we have a diagnostic center at 119, we are now able to do CTs, ultrasounds, and MRIs same day. If the injury walks in at 10 o'clock, take him straight down to 119, get his MRI, and bring him back, and we have the results in hand. So looking at some of the numbers for fire, we have reduced their return to work status from 15 days average prior to coming to St. Vincent's, and now it's averaging three days. So you went from 15 days returning to work after an injury to 3. So this is where we focus our time and attention. Well, it's certainly the injuries and the follow-ups and the physicals.
And I won't put, I'm not going to lean on COVID. It's been leaned on enough. But as it relates to it, there have been impacts in the market that have reduced our structure and the resources within the market. And the influx of this year, as the rebound year, it shows in our offices. We're averaging a lot of visits. It's been upwards of 80 to 90 plus visits in a given day for this one particular location. So, and that's not a complaint. We're glad to service the community and all the employer needs in the area. However, it does have its impact in all different areas. And injuries being one of those. But if we are your midday urgent care or ER, that first column looks really good. So, because your average wait time in an ER is 4 hours. So it is again, like Kim said, I'm proud of the work that we have done. We have done, and we want to do better. We do desire to do that, and we have worked with. We initiated and created the Brookwood system for occupational medicine. We know how that runs as it relates to it, and how the structure is. We work side by side in an alliance with UAB and UAB's program, where we speak with them all the time as it relates to how their occupational medicine program is running and working and trying to create those efficiencies. We originally had started working with Alacon from the beginning to actually, so a lot of that was based on similar operational workflows. So we work on this all consistently. And we want to work with you to make sure that we maintain that consistency and get better as it relates to it. And we hope to have that opportunity.
One last thing, because y'all are the finance committee, now the hospital charge masters and charges are available online. And Ascension is the lowest cost provider in the city. So we know that you're getting, for as far as the hospital services, we know that you're getting the best rates down there. So we're proud of the program, and we have great relationships with Chief Nick and Brandon and the police department. We talk to them pretty much daily. And like I said, we take great pride in taking care of your city's employees. So if you have any questions or anything else you have for us,
Can we get a copy of the contract? Do we have, somebody have?
I think work comp is non.
We don't have
It's a non-contractual.
Yeah, so there's not a contractual agreement.
So therefore we have no service level agreement in terms of what we would expect. Because this is really not impressive at all to me. This is really worse than I thought. I'm not pleased with this at all, so, but I'll have to do some further digging to understand what other options.
Yeah, and I mean, you obviously also heard from Berkeley tonight, and I think it's important to hear from Harold as well.
Yeah.
With regard to this concern, and Cobbs Allen as well. I mean, we've been asking them to take a look at it so that they can help us
Okay.
with it.
And I wonder if we ought to look at doing drug testing differently, if that's the big issue that's holding people up. I mean, when someone's hurt, that's a different animal than drug testing. Where are you guys providing this service? Is it
Right here on the corner of Lakeshore and Columbiana.
Okay.
So yeah, I would just ask that you carry it over
Is that
for
Mike
tonight.
Bond?
Yeah.
Is that Mike
No,
Bond?
it's the third floor above Mike Bond.
Yeah. It's in the Med Health building on the
Yeah,
third
I'm
floor.
familiar with all that.
But you know, it may be possible too to go back and pull data when you were with the other provider, because it was just 3 years ago. So you may be able to pull that data too and look at wait times and stuff and compare it.
Yeah, all I can tell you is the empirical.
You're don't shoot the messenger.
Yeah, the empirical information that we have gotten from department heads is that it is pretty consistent across the boards that this has been an issue with regard to wait times.
And it's drug screen only that you're referring to.
And that's the, at least the overwhelming majority of what I'm talking about. And it is causing significant problems within the city's workforce and what, keeping people working, and as well as just being convenient to people, either applicants or employees that are coming in. You know, Berkeley story is not the first that I've heard of. Okay, my shift's over, now what do I do? And I can't get home because of, you know, I mean, we're running into some significant logistics issues as well as other issues. So,
Okay.
so anyway, I'd rather Harold speak to that than me,
okay.
but you know, I think this is the drug testing really is a real issue that's, I don't want anyone to leave thinking, well, this is just drug testing, right? And this is, or the drug testing isn't a big deal. That is a really big deal. We have a lot of people that go to these for multiple reasons, and that's got to move in an efficient manner.
There have been occasions, it's been reported to me, that St. Vincent has not had the sufficient forms required
Yeah.
to drug policy for the MRO to essentially to be able to report and verify the results of the test. And that having to do with time, I'll let somebody speak some more about that, but I have been called.
Has to do with compliance, yeah.
Correct.
Okay. We appreciate it.
Thank you guys.
Thank you for your
Thank you
Without
guys.
objection, we'll carry that over.
Appreciate it.
Okay, starting at the top, 250417, request for consideration of 18th Street revitalization. So the only report that you wanted to provide is kind of the utilities, or?
Yeah, so Bowles has pulled off for a couple of weeks, waiting on other utility providers to do some relocations, specifically up in the valley. So after the first of the year, we'll start back.
Okay. We want to keep it moving. We don't want delays. Okay, so we'll carry that over for our next meeting. 12/11/22, bid opening set for January 23rd at 4:45. Everything went out fine, so we're still on track for that bid opening for the street signs. So we'll carry that over pending the bid opening. 01/12/22, request to authorize the mayor to sign an agreement and remit 22-23 budget appropriation for Homewood Chamber of Commerce.
Motion to approve.
Okay.
Second.
It's already
Moved by
budgeted, I mean,
Mrs.
there's no
Smith.
need to have a discussion about it.
Yeah.
We already discussed it.
Second by Mr. Harden. Any questions on that? All in favor say aye.
We're still at
Aye.
five,
All
right?
opposed by
Yeah.
the same sign. That passes 5-0.
It was me and John.
The last item, 02/12/22, request to authorize the mayor to sign an agreement and remit 22-23 budget for the Exceptional Foundation.
Motion to approve.
Second.
Mrs. Smith. I heard Harden again.
No, and I'll give it to him.
So, any other questions on that? All in favor say aye.
Aye.
All opposed by the same sign. 5-0, that passes. So we will be sending
Two items, so.
just 2 items to council tonight. Anything else?
Things are great. How are you? It sucks.
Adjourned?
We're adjourned.